What should you do after your sutures are removed? Have you just had your sutures taken out and are wondering what comes next? It is essential to take care of your wound properly to ensure it heals well and looks good. Let's go through some important steps you should follow after your sutures are removed. First, for the first day after the removal, keep the area clean and dry. Avoid soaking the wound in water. After that, you can gently wash the area with mild soap and water once or twice a day. Make sure to pat it dry with a clean towel. Steer clear of harsh chemicals like hydrogen peroxide or alcohol, as they can slow down the healing process. If thin adhesive strips, known as Steri strips, were placed on your wound, do not remove them. They will fall off naturally within several days to 2 weeks. If you notice any loose edges, you can trim them carefully. It is best not to apply ointments, petroleum jelly, or sunscreen until these strips have completely come off. Next, avoid soaking in baths, hot tubs, or swimming pools until your wound is fully healed. Water can interfere with the healing process and increase the risk of infection. Showers are usually fine after the first day, but be cautious and avoid direct water pressure on the wound. Once your wound has healed, it is a good idea to apply sunscreen daily to the scar. This helps prevent darkening and promotes better healing. Keep an eye on your wound for any signs of infection. Look for redness, swelling, pus, increased pain, or if the edges of the wound start to open. If you notice any of these symptoms, contact your healthcare provider right away. It is also important to avoid strenuous activities that could reopen the wound. Listen to your healthcare provider's advice about physical activity. Stay away from heavy lifting, pulling, or exercises that strain the area until you are fully healed. If you experience discomfort, over-the-counter pain medications like acetaminophen or ibuprofen can help relieving it. Continue to care for your skin gently. Avoid picking at scabs or peeling off adhesive strips too soon, as this can lead to scarring or reopening the wound. Usually, dressings are no longer needed once the edges of the wound have closed, which typically happens within 48 hours after suture removal, unless your healthcare provider advises otherwise. By following these steps, you can support your healing process and reduce the chances of complications after your sutures are removed. Always remember to follow any specific instructions given by your surgeon or healthcare provider tailored to your surgery and the location of your wound.